Hi, I'm Nate, a doctor working in gynecology, and today we're going to talk about the menopause. It affects a large number of people, and it happens when the store of eggs in the ovaries have all been released in a person's lifetime. This limits the production of the hormones estrogen and progesterone, which are released during the menstrual cycle. Therefore, menopause starts after the person has had their last menstrual bleed, while peri-menopause is the time period which leads to the menopause. On average, this lasts for 4 years, but can be as long as 10 years for some. The typical way in which menopause is diagnosed is when a person has not had a period for at least 12 months. This way of concluding menopause may be difficult for people who are on a hormonal contraceptive, like the Mirena, or if they don't have a womb. We can do blood tests to measure a hormone called follicle-stimulating hormone. If the level is high on 2 samples taken at least 6 weeks apart, this would suggest that the person is menopausal. However, in most situations, assessing the symptoms of menopause is sufficient. By the way, if you haven't done so, please subscribe to the channel and give this video a like. In the UK, the average age for a person to arrive at menopause is 51, with the majority of people having their last period between the age of 45 and 55. 1% of the population under the age of 40 may have primary ovarian insufficiency, in which the ovaries are not able to produce the hormones estrogen and progesterone consistently. Thus, they may have symptoms akin to menopause. During the perimenopausal phase, periods can become irregular, with some experiencing longer cycles while others having shorter cycles lasting about 2 or 3 weeks. The volume of blood loss during the period may also increase. Of the people who are entering or have entered menopause, 8 out of 10 will experience symptoms, with a quarter of them suffering with severe features. The most talked about struggle is that of hot flushes and sweats, which can last for minutes or can be constant. People may also experience vaginal and vulval dryness, which can lead to sex being painful, vaginal bleeding, recurrent bladder infection, or even incontinence. They may also have a reduced sex drive. This might be a standalone problem or can be due to dryness or body image issue, which can be problematic during the menopause. Sleep can also be affected, leading to people becoming easily irritated or having poor concentration and memory function during the day. People who are menopausal or perimenopausal are also at risk of suffering with depression or may have new onset anxiety and nervousness. As you can see, menopause can lead to many health issues. It can also increase the risk of other health conditions such as osteoporosis, putting people at risk of fractures. Therefore, those who have gone through the change are advised to exercise regularly and to have adequate amounts of calcium in their diet. Menopause also increases the risk of heart diseases, strokes, and dementia due to Alzheimer's disease. The most effective way of managing symptoms of menopause is with hormone replacement therapy, or HRT. This can be given in different ways, such as oral tablets, or nasally, or through the skin in gels or patch, or a vaginal ring which delivers estrogen, and an intrauterine system which releases progesterone. For women with a womb, we would provide combined HRT containing both estrogen and progesterone, while those without a womb will only require estrogen-only HRT. Women struggling with vaginal dryness or have problems with urination, topical estrogen applied into the vagina may be required, whereas systemic HRT is beneficial for those experiencing mood problems, hot flushes, and sweats. HRT has also been shown to reduce the risk of heart diseases and osteoporosis. And there is some evidence that it lowers the risk of colorectal cancer and Alzheimer's disease. When starting HRT, we advise starting as early as possible, as this improves the protective benefits of the treatment. Nevertheless, it's important to note that starting HRT will come with its own set of risks. Therefore, starting HRT may be unsuitable for people at risk of strokes and clots, those with uncontrolled raised blood pressure, or have a liver disease, or have a history of hormone-sensitive cancer. The main risk is developing blood clots, especially during the first year of treatment. The dose, the type of HRT, and how it's given can all play a role with the risk of developing blood clots. For example, oral HRT increases the risk of blood clots, while HRT absorbed through the skin does not. And the risk is higher for those who are obese, smoke, or have a history of blood clots. There is also a slightly increased risk with suffering from a stroke when taking oral HRT. The evidence as to whether HRT increases the risk of breast cancer is mixed. Although HRT is effective in managing symptoms, it's not for everyone. You may have contraindications which make starting HRT too risky, or perhaps you worry about the risks of HRT, but the symptoms are affecting your life. What are the alternatives? The specific form of treatment will depend on which symptoms need addressing. For instance, cognitive behavioral therapy can be offered to people with mood problems, while antidepressants such as venlafaxine or a medication called clonidine or gabapentin can be offered instead of HRT to manage hot flushes and sweats. To help improve bone health, people with osteoporosis are provided with biphosphonates such as alendronic acid along with vitamin D. There are many other therapies that are used to help people manage menopause, though their effectiveness have not been substantiated. For instance, isoflavones, which are found in soy, acupuncture, evening primrose oil, black cohosh, vaginal lubricants have all been trialed for different aspects of menopause. But speak to your healthcare provider before starting treatment. Menopause is a big part of life for many, especially as we're living longer and busier lives. The more problematic parts of menopause can have a huge impact on people's standard of living and can hamper both professional and social activities. Thankfully, many of these symptoms are temporary, and there are many ways for which they can be controlled. Give this video a like if you found this helpful, share, subscribe, and I'll see you again soon.